The treatment options for multicenter Castleman's disease first include steroids. Steroids will control the disease for a while, but usually patients need to take quite high dose steroids, which is not tolerable for a longer period of time because of side effects. There are antibodies which have been used for lymphoma. One of them is called rituximab, which targets cells in the lymph nodes. This sometimes can provide temporary relief. The actual experience of this antibody therapy in what we call HHV8 negative or idiopathic multicenter Castleman's disease is very limited, so its efficacy is not very well known. Other more novel therapies target a molecule called interleukin-6. Interleukin-6 is made by the Castleman's disease lymph nodes, and that is what gives rise to the symptoms in the patient. It's not specific for Castleman's disease, but can also occur in other disorders. For instance, if you have the flu and you feel sick and miserable and you got fevers, it's actually interleukin-6 which is responsible for that. And patients who have multicenter Castleman's disease have a chronic flu-like syndrome which can become quite severe, and they can in fact succumb to their disease. So IL-6 is quite critical, or interleukin-6 is quite critical to the pathology and pathogenesis of Castleman's disease. And targeting it directly with an antibody is very effective. There are currently 2 antibodies available. One was developed in Japan. It targets the interleukin-6 receptor. It's called tocilizumab. It's approved in Japan for Castleman's disease. There is another antibody called ciltuximab, which has undergone a worldwide randomized trial and has found to be effective in that. And ciltuximab is an important new treatment for Castleman's disease. And it would, for me, be the first choice in this particular patient.